So talk to me a little bit about the evolution of point of care ultrasound. Now, again, I'm of a certain age. I did my fellowship in the late 90s. Like that wasn't really a thing. Like when we wanted to do an ultrasound of any sort, we called radiology or emergency. Actually, emergency medicine was dabbling a little bit. This is sort of a standard skill now these days. Like what's the you were sort of involved in that sort of evolution. I mean, what's it look like from your standpoint, from the evolution of no training to actually now it's an expected skill and probably very helpful at the bedside?
Well, I think it depends on where you train. So there are some institutions where point of care ultrasound has been finely tuned in terms of education and practice for decades, and our ultrasound faculty here at CHEST represent a lot of those locations, right? And for most of us, though, I think where we trained and where we practice now, we're much earlier in the evolution towards this utopia of everyone knows how to scan and has a machine to scan, has access to that. So a slightly different perspective for me than for others, but when I started in the ultrasound space, it was out of interest and because no one else was doing it, and I thought it was cool and useful. But back then, we had little oscilloscopes, basically, right? It was this little tiny square and a big old probe, and
let me get the bedside of the table, and you brought this cart over.
Yes, you could. I think that's a vein. I think. And of course now, the technology has evolved to now we have pocket machines, which are easy to carry around on rounds. And the bedside machines are much more, they're much better than anything we saw 15 years ago. But yes, you're right. I think it is becoming standard practice, standard of care. It is standard of care for some applications of critical care medicine, and trainees are expecting it in their training programs, and I think hospitals are starting to expect it in your skill set. And at the same time, we're grappling with how to make sure that folks do it right. They're trained well and they're doing it right. At my institution, we are in the throes of trying to go from some people know how to do it, often it's the trainees more than their faculty, to everyone has a basic skill set, the essential skill set, and then we have some advanced providers. And how do we manage that? That is a tremendous work in progress.
All technologies go through this evolution where the older faculty, again, I include myself in that subgroup, didn't train in it. The younger faculty and fellows get very good at it iteratively, and there's this weird dichotomy of the most senior people are the least competent to do this sort of evolving and potentially essential skill set. I mean, we saw it for a number of procedures. EBIS, we see it, but
and there's implications for that. There are significant implications for that, both in terms of patient safety, right, quality of care, as well as the education dynamic. And so I think all education, ultrasound efforts need to focus not just on how do you train a few people to do it, but actually how do you train the trainer and reach out for faculty development as well as your trainee education.